Hello dear colleagues, and Nikita is again with you, and welcome back to our Novitomia channel. And today we're gonna talk about surgical guides based on braces, based on orthodontic devices, and we're gonna discuss CT scans, dental impressions, and so on, their expiry date, how they have to be performed, how to prepare for such surgical guide procedures based on braces and so on and so on, which mistakes can you make while making surgical guides. So I think is going to be interested. And also I would like to thank you for your attention and for staying with us, since we have didn't hear each other for a long period of time. As a matter of fact, we're preparing right now our own educational platform on English language, our AI bot, and a lot of different solutions which can be interesting for you. We are focused right now, and we are looking forward to introduce you our profound lessons and profound courses in RealGUIDE and in navigational surgery in general. So let's continue our lesson. So today we have such an interesting case, and I will show you the difference between data, different data, and we're gonna discuss it in today's video. But firstly, before we have started, I would like to just share my opinion about surgical guides based on braces. Once again, it's my personal opinion based on my knowledge and based on my experience, but it's not rather good idea to wear braces. Sorry, it was a joke. It's not a really good idea to plan your surgery before braces and before orthodontic activity, because it's extremely complicated to calculate the teeth movement during the orthodontic treatment, and it's much more safer and much more logic just to plan your implantation, just to plan your surgery after braces have been done, or in the final steps of your orthodontic treatment. I think it's clear, and that's almost obvious for every doctor. Depends on being a surgeon or prosthodontist or orthodontist, never mind. What's next? Since we are applying some force to the teeth, like with the braces, with different dental devices, orthodontist devices. So since the movement force is applied to teeth, we have to realize that every day, every single hour, teeth are moving, teeth are changing their position in the bone, and therefore we almost don't have much time for fixation of the data. What I mean that CT scans and dental impressions or dental scans have to be made ideally in the same day. Okay, if they are made within 3 days, and it is not acceptable that they have to be made within a week or even 2 weeks. Now we have such a wonderful example of what we obtain when CT scans are made after 2 weeks after the impression made. So let's try to match here CT scans and match CT scans and match the intraoral scans, and let's see what we have. Now you can see that our jaw, our scan is aligned somehow to CT, but if we take a closer look, we understand that, yeah, the shape of the teeth is okay, the shape of the braces even is okay. By the way, this scan was made of, the scan is performed by silicone impression, and we will compare the silicone impression and the dental scan as well. But let's just take a look at the position of the incisors here, the frontal incisors, and we see the difference between the position of this 1.1 and 2.1 teeth, and the difference between position is about 1 millimeter within 2 weeks. And that's the very good sign that it's not acceptable that CT scans and intraoral scans have to be performed on different days. They ideally, I repeat, they ideally have to be taken within 1 day. So, for instance, you meet your patient in the morning, you make intraoral scans, and you make a CT in, CBCT at the same day within several hours, because it's extremely important to fix everything all together. And the second thing about braces and about data is that the operation itself has to be performed within 1 week after you have taken your data. I mean, after you have taken your scans and after you have taken CBCT, because if you see that the difference between the position of the teeth is about 0.9 millimeters within 2 weeks, so we have a gap like 0.1 millimeter for every day, almost. And we realize that within the week there will be an error equal to for about 0.5, 0.4 millimeters. That's why our goal is to perform the operation with guides as soon as possible after we have taken the CT and after we have taken the impressions. And now we continue the same case, the same patient, but what we have changed. Firstly, we have made intraoral scans instead of silicone impressions for this case. And secondly, we have made a new CBCT scans and intraoral scans in the same day. So let's see the difference and let's see what we're talking about right now. You remember the previous scans and the previous alignment, and now let's compare to what we have today, what we have in this case now. And as we can see, the shape of our intraoral scan and the shape of the teeth in CBCT, and we see the perfect alignment. We see the perfect alignment that all the shapes and all the lines perfectly suit the shape of CBCT. And that's the sign that since it has perfect alignment, that we can proceed the further work. I mean, surgical guides, surgical guide construction, surgical guide planing, and we now more sure, we are now more how let's say, so the probability of success in this case is much more higher than the previous one. With previous data, where data was taken in different weeks even. And again, don't be relaxed, since you have obtained this aligned data like CBCT and scans in the same day, because time goes every day. And when you have received such data, you have to plan your guide as soon as possible. Okay, I think you have realized it, understood it. And secondly, what I would like to show you in this case is the comparison between intraoral scan and silicone impression. These cases are quite rare, where we can compare these two different approaches. And talking about the orthodontic patients and patients with braces, I prefer to make intraoral scans instead of silicone impressions, and let's watch why. So we press our model got from silicone impression, we press match STL and STL, and let's just try to match with our intraoral scan. So we choose here the from file, the file we are going to align, and to file is the file to we are going to align to. Yeah. So we press matching by brush. That's the easiest one, and let's just use the occlusal surface of the teeth and the occlusal and palatinal surface of the teeth as the most stable points. And now we see the difference, and the difference is quite significant. We are not even taking into account the malposition of the teeth because of the time, because of 2 weeks time gap between the impressions and scans were taken. Yeah, but let's also take a look at the distal area of the scans and model, and we see the difference of the shape of the tissues is significant. What does it mean? If you have ever worked with a silicone impressions, you know that when you mix the components of the silicone impressions, they become very solid, very hard, and that's actually the main advantage of silicone impression, that they are mixing all together. Chemical reaction goes on, and the silicone impressions becomes actually solid and keeps the shape of the teeth and so on. But since you have braces, it's very, very hard to remove the tray filled with silicone, A silicone or C silicone, never mind. It's very hard to remove out of the mouth the tray containing the silicone material without damaging the silicone by these braces. I think you understand, because it's quite simple, because these braces actually hold the silicone inside, and doctor prosthodontics, maybe who takes the impression, has to apply a lot of force to remove the tray, as I have said, and that's why the silicone impression can be damaged and not be so perfect like the intraoral scan. But intraoral scan can also be spoiled by not knowing some tips and features, because let me just show you. I will turn this model off. As a matter of fact, these metal pieces of the braces are made of metal, as I have said, yeah. and that's why they can be reflected, because when the intraoral scan is being performed, what does it mean? This means that your scanner makes a lot of photos all together, and it's just mixing them and combining into the 3D model. And the metal surface reflecting the light, and that's why if you do not use the special spray for metal surfaces, special spray for intraoral scanning, the shape of the braces can be damaged in your scan, and they cannot be scanned even. So that's why when you make intraoral scanning with braces, try to use your intraoral scanning spray just to make sure that you will receive all the information regarding the shape of the teeth and regarding the shape of the braces, because that's the third point which I would like to tell you today, is that we call it actually a security zone. It's not this security zone was not taken from, I don't know, some kind of scientific reports or literature or so on and so on. That's our own name, so you can name it as well. What is the main idea? The main idea is very simple, that when we see the metal stuff made of metal like braces, we actually don't know the exact shape. Even with the spray, we actually don't know exact shape of the metal pieces of braces, and we keep in mind that there is the probability that the shape of these particles is different. That's why we made a special bumper, we made a special security zone just to avoid the contact of the hard surgical guide with this area, not to let it cause the malposition of the guide, not to make it shake on the teeth. And that's why by making this bumper, by making this security zone on braces, we avoid any contact with the surgical guide and the pieces of braces, making surgical guide being based only on occlusal part and palatinal part of the teeth and a bit of the vestibular part of the teeth, but not being in any contact with braces. And also there is, I don't know, in Russian it's called chain between braces, but what I mean here is that you see the metal part between braces here, and it must be taken off, of course, during the operation, only during the operation with the surgical guide, because if you try to place your guide on the on this chain, your guide firstly will be weak, secondly probably you will face with difficulties with the fitting, because this metal chain, which is shown only on CBCT here, most probably will not be fully scanned. So of course this is the tip of the iceberg. So the topic of surgical guides on braces and with prosthodontics is much more complicated, much more profound, but this is this were the main tips for making surgical guides based on braces, and I hope you liked it and this video was really useful. Thank you for watching, dear colleagues, and by the end of this video I would like to thank you for being with us, for watching us, and I would like you to know that we are preparing something interesting for you. We are going international. We are going to different countries. And actually, as a founder of this company, of this channel, I'm extremely encouraged of how many people write us from all around the world. Many thanks for your support, for your love, for your attention. And believe me, we appreciate it, and we are preparing our solutions for you, our bots, our courses, everything we have by this time will be soon presented for you. So thank you again for watching. Please press like, subscribe, and till next video. Bye bye. Have a nice practice. Have a nice day.